Welcome to my channel, Body Talk. Overview: a case of pneumonia, inflammation, and fluid in the lungs brought on by a bacterial, viral, or fungal infection is known as pneumonia. In addition to making breathing hard, it can result in fever and coughing up crimson, green, or yellow mucus. Pneumococcal illness, COVID-19, and the flu are major causes of pneumonia. The etiology and severity of pneumonia determine the course of treatment. What is pneumonia? A bacterial, viral, or fungal infection of the lungs is known as pneumonia. Pneumonia can result in fluid or pus in your lungs and cause inflammation or swelling of the lung tissue. Compared to viral pneumonia, which frequently goes away on its own, bacterial pneumonia is typically more severe. One or both lungs may be affected by pneumonia. Bilateral or double pneumonia is the term for pneumonia that affects one of your lungs. What distinguishes bacterial pneumonia from viral pneumonia? Although all pneumonia is inflammation brought on by a lung infection, the symptoms you experience will vary based on whether the underlying cause is a bacterial, fungal, or viral infection. Compared to viral pneumonia, bacterial pneumonia is typically more prevalent and more severe. A hospital stay is more likely to be necessary. Antibiotics are used by providers to treat bacterial pneumonia. Flu-like symptoms are caused by viral pneumonia, which usually goes away on its own. Viral pneumonia typically doesn't require special care. What kinds of pneumonia are there? We classify pneumonia into three categories: ventilator-associated pneumonia, hospital-acquired pneumonia, and community-acquired pneumonia, depending on the organism, virus, bacteria, or fungus that caused it. Pneumonia acquired in the community cap. Community-acquired pneumonia is the term for pneumonia contracted outside of a medical setting. Among the causes are bacteria. The most frequent cause of CAP is infection with Streptococcus pneumonia bacteria. Bacteria often known as pneumococcal illness. Meningitis, sinus infections, and ear infections can also be brought on by pneumococcal illness. Atypical pneumonia, which typically has less severe symptoms, is caused by the Mycoplasma pneumonia bacteria. Haemophilus, influenza, chlamydia pneumonia, and Legionella legionnaires illness are additional bacteria that cause CAP. Viruses, pneumonia, can occasionally result from viruses that cause the common cold, influenza, COVID-19, and respiratory syncytial virus RSV, fungi molds, pneumocystis, girovesi, bacillioids, and cryptococcus are fungi that are rare causes of pneumonia. The most vulnerable to fungus-induced pneumonia are those with weakened immune systems. Protozoa, toxoplasma, and other protozoa can occasionally cause pneumonia. Pneumonia acquired in hospitals, HAP. Hospital-acquired pneumonia HAP can occur while you are receiving treatment for another sickness or procedure in a hospital or healthcare facility. Since methicillin-resistant, Staphylococcus aureus, MRSA, and other antibiotic-resistant bacteria are frequently the cause of HAP. It is typically more dangerous than community-acquired pneumonia. Accordingly, HAP may worsen your condition and make treatment more challenging. Pneumonia, linked to healthcare HCAP. HCAP is available in long-term care facilities and extended-stay outpatient clinics. Similar to hospital-acquired pneumonia, antibiotic-resistant bacteria are typically the cause. VAP, or ventilator-associated pneumonia, you run the risk of developing ventilator-associated pneumonia VAP. If you require a respirator or other breathing apparatus to help you breathe while you are in the hospital, usually in the intensive care unit. VAP is caused by the same germs that cause community-acquired pneumonia and drug-resistant strains that cause hospital-acquired pneumonia. Pneumonia, from aspiration when solid food, liquids, spit, or vomit enter your lungs through your trachea windpipe. It is known as aspiration. Your lungs may become infected if you are unable to cough these up. How do I distinguish between pneumonia and the flu or the common cold? It can be challenging to distinguish between the symptoms of pneumonia, the flu, and a cold, and only a medical professional can make that determination. Serious symptoms that could indicate pneumonia, like congestion or chest pain, should be treated by a doctor because the illness can be fatal. Having trouble breathing, a fever that is at least 102 degrees Fahrenheit, 38.88 degrees Celsius, spitting up spit or mucus that is green, yellow, or bloody. Who is most susceptible to pneumonia? Pneumonia is more likely to strike you if you are younger than 2 or older than 65. Do you have a heart or lung ailment? Emphysema, pulmonary, fibrosis, sarcoidosis, asthma, cystic fibrosis, and chronic obstructive lung disease are a few examples. Do you suffer from a neurological disorder that interferes with swallowing? Aspiration pneumonia is more likely to occur in people with dementia, Parkinson's disease, and stroke, or in a long-term care facility or a hospital. Smoke. Are expecting a child. Possess a compromised immune system. If you are receiving chemotherapy, have received an organ transplant, have HIV/AIDS, or are using immunosuppressive medicines, your immune system may be compromised. What is the prevalence of pneumonia? Pneumonia can strike anyone. Millions of Americans receive a diagnosis of this prevalent condition every year. In the United States, pneumonia claims the lives of about 55,000 individuals annually. In poor nations, it is the leading cause of death. Causes and symptoms and causes. What are the signs and symptoms of pneumonia? Symptoms of pneumonia depend on the cause. Symptoms can range from mild to severe. Babies, young children, and older adults may have different symptoms. Symptoms of bacterial pneumonia. Symptoms of bacterial pneumonia can develop gradually or suddenly. Symptoms include high fever up to 105 F or 40. 55 C, cough with yellow, green or bloody mucus. Tiredness, fatigue, rapid breathing, shortness of breath, rapid heart rate, sweating or chills, chest pain and or abdominal pain, especially with coughing or deep breathing, loss of appetite, bluish skin, lips or nails, cyanosis, confusion, or altered mental state. What symptoms might one expect from pneumonia? Pneumonia symptoms vary depending on the reason. How to severe symptoms are possible. Older. Adults, infants, and young children may have distinct symptoms. Bacterial pneumonia symptoms. Bacterial pneumonia symptoms might appear gradually or all at once. Among the symptoms are a high temperature up to 40.55 C or 105 F, a cough that produces crimson, green, or yellow mucus, fatigue or tiredness, breathing quickly, breathing difficulties, an elevated heart rate, perspiration or chills, abdominal and or chest pain, particularly while heavy breathing or coughing, a decrease in appetite, cyanosis, or flushed skin, lips or nails, perplexity or a change in mood, viral pneumonia symptoms. Viral pneumonia symptoms typically appear over a few days. You may experience symptoms resembling those of bacterial pneumonia, or you may also have a dry cough, headache, pain in the muscles, severe fatigue or weakness. Pneumonia symptoms in young children, newborns, and babies may not exhibit any pneumonia symptoms at all, or their symptoms may differ from those of adults. These symptoms include perspiration or flushed skin, perspiration, chills, and fever, cough, tachypnea, or quick or difficult breathing, a decrease in appetite, throwing up insufficient vitality, anxiety or fussiness. Babies and young children may exhibit the following symptoms: noisy breathing or grunting sound with breathing, a lower volume of urine or less wet diapers, pale skin, limpness, weeping more than normal, having trouble eating. Pneumonia symptoms in individuals over 65. Pneumonia symptoms, such as coughing and shortness of breath, might be moderate, or less obvious in adults over 65 or in those with compromised immune systems. Chronic illness symptoms could get worse. The following are some symptoms for older adults: an abrupt shift in mental state, lack of appetite, exhaustion. What is the cause of pneumonia? When your immune system targets an infection in the alveoli, which are tiny sacs in your lungs, pneumonia may result. Your lungs swell and leak fluids as a result. The infections that cause pneumonia can be caused by a variety of bacteria, viruses, and fungus. The most frequent cause in adults is bacteria, while the most frequent cause in school-age children is viruses. The common cold rhinovirus is one of the common infections that can cause pneumonia. SARS-CoV-2 or COVID-19, the influenza virus or flu, HMPV, or human metapneumovirus. HPIV, or human parainfluenza virus. The sickness of Legionnaires. The bacteria Mycoplasma pneumonia. The pneumococcal infection. Pneumonia caused by pneumocystis, or SVO, or respiratory syncytial virus. If you're enjoying this video, please subscribe my Body Talk channel for more body insights. Thanks for watching. See you soon.